Dr. Ilana Stinson, New England Medical Association, Eileen O'Grady, Private Equity Stakeholder Project, Ellen McGinnis, Massachusetts Nurses Association, Audra Sprague, Massachusetts Nurses Association, and representatives from AFSCME as well. Today, at our hearing, we had an empty chair. An empty chair that Dr. Ralph DeLatorre, CEO of Steward Health Care, was under legal orders to fill. Ralph DeLatorre is a coward. The nurses who testified today against him, they are the heroes in our healthcare story. He is using his blood-soaked gains to hide behind corporate lawyers instead of responding to the United States Senate Health Committee's demand for answers to how he could unleash such callous cruelty on the communities that he promised to serve. In light of the egregiousness of the Steward Health Care crisis he caused, the United States Senate and the American people deserve answers, and they deserve accountability. Yesterday, I released a new report, the Steward Health Care Report, how corporate greed hurt patients, healthcare workers, and communities. Details how Steward's failure with Cerberus and Medical Properties Trust harm workers, patients, and communities. Here's what we found. Death rates for certain conditions at Steward-owned hospitals went up as rates for those same conditions went down at other hospitals. Patients at Steward-owned hospitals left the emergency rooms without receiving care at vastly higher rates than the national average. In the last decade, Steward Health Care hospitals closures translated to a minimum 1,500 patient beds, 4,400 jobs lost, and as the Boston Globe highlighted, at least 15 people died. 15 innocent people lost neglect. This was malign neglect from Ralph DeLatorre and his corporate cronies. Despite the complexity of the financial scheme that Steward engaged in, the report makes this story stunningly simple. Steward, Cerberus, and Medical Properties Trust got into healthcare for profit, and they got what they wanted. Cerberus made $800 million. Medical Properties Trust continue collecting rent, outrageous rent, from those hospitals. And Ralph DeLatorre used Steward funds to donate millions to his own children's elite private school, bought multi-million-dollar yachts and homes, and took lavish vacations with the funding that should have been in the emergency rooms and the ICUs of the Steward hospitals across Massachusetts and across the country. In the course of Steward Hospital's bankruptcy, 2 hospitals, Kearney and Neshoba Valley in Massachusetts, have closed. And several hospitals in Ohio and Pennsylvania are right now struggling to survive. Workers have lost their jobs, communities have lost their hospitals, patients have died, all because of Ralph DeLatorre and his unending greed. But instead of answers from him today, we got an empty chair. So since Ralph DeLatorre has shown only contempt for our healthcare system, its patients and workers, the United States Senate must hold him in contempt. And I look forward to the committee vote, but I will not stop there, because we know that Steward Health Care is not an exception. It is an example of how private equity and real estate investment trusts treat hospitals as their own personal piggy banks. This is why we must create permanent reform that puts patients first at every level of healthcare. My Health Over Wealth Act would set essential guardrails on private equity in our healthcare system and guarantee that corporate wealth does not come before public health. My thanks again to the dedicated and brave workers who have raised their voices when they saw unchecked corporate greed hurt their patients. Their courage is matched only by Dr. DeLatorre's cowardice. So They deserve more than a system that allows greedy CEOs to exploit the healthcare system for personal profit. The American people deserve more. They deserve a healthcare system that serves their health, not corporate wealth. So we're going to hold Dr. DeLatorre accountable. We're now going to move to a bipartisan contempt citation, criminal and civil, against Dr. DeLatorre. He will appear before our committee. He will answer. He will be accountable to all of those stakeholders who are represented right here, standing behind me today, because they and the workers they represent, the patients they represent, they're the real heroes and the real victims of what Dr. DeLatorre and all of his cronies have perpetrated upon the healthcare system. Now let me turn and recognize a great American labor hero, the president of the AFT, Randy Weingarten. Welcome.
So we are the second largest nurse union in America, and one of our hospitals, a rehabilitation center in Warren, Ohio, has been the victim, and the patients there and the nurses there have been the victims of Dr. DeLatorre's avarice and greed. But I am honored to be with our colleagues from the M&A, the Massachusetts Nurses Association. I'm honored to stand with the doctors and with the public servants here who have also been spending so much of our time collectively on the issue of the effect of private equity. And like you, Senator Markey, this summer we put out a study and a report about how private equity is really, its avarice is really punishing, hurting Americans across the country by basically taking over, gobbling up hospitals, healthcare, and other kinds of healthcare systems and centers, and then spitting it out after they have taken everything they can and hurting patients around and Americans around the country, and also hurting the nurses and the doctors and the RTs and the PTs and the hygienists and the people that clean the hospital floors, hurting all of them across America. No wonder Americans are so afraid about what's happening in terms of their health care. There is a reason behind it, and Dr. DeLatorre is one of those reasons behind it. So I just want to say, first and foremost, thank you, Senator Markey, for taking this on. Thank you for holding this hearing. Thank you for having these folks out there and representing and seeing the frontline doctors and nurses and, as I said, other healthcare professionals who have been seeing this each and every day. And in terms of just DeLatorre, I mean, it's hard for me to even call him a doctor, because doctors take a Hippocratic oath, and it's a moral atrocity, as the doctor here is smiling, because it is a moral atrocity for a doctor to actually undermine that oath in every step that doctor takes, and that's what DeLatorre does. And think about what Steward has done. It was about his greed, it was about his avarice, and now who is holding the bag? The patients, the citizens of Boston, the workers in Boston, on all throughout the country. So the Steward bankruptcy is Exhibit A of what we are deeply concerned about. It is exactly what private equity's impact on healthcare is, and that flies in the face of patient care and of the aspiration of people to be members of the middle class. Now, as I said, the AFT represents the nurses at Hillside Rehabilitation Hospital in Warren, Ohio, which is run by Steward and currently faces an uncertain future. But let me tell you a little bit about the Steward's story even before Hillside Rehabilitation Hospital was in the crosshairs. What we saw in the last few years is that Seward shuttered the doors of the Northside Regional Medical Center in Youngstown. Youngstown, Ohio and Warren, Ohio are right next door to each other. This was the only labor and delivery department in Youngstown. They are about an hour south of Cleveland. What it meant is that there is no labor and delivery services in that county for people who live in Youngstown and Warren and Lordstown. None. Zero. Because of their actions. So it was not just the health care that was affected, it devastated the entire community, laying off nearly 400 workers, costing Youngstown almost $1 million in income tax revenue. And if you know Youngstown, Youngstown could afford none of that. And it was the next blow to what Youngstown, to the issue about Youngstown's proud past and industrial past. You've heard that from Lordstown, from Youngstown, from Warren. This is the effect of what Steward is doing. This is the effect of what LaTorre is doing. It is hurting healthcare in America. It's hurting workers in America. These nurses who work in uncertain times each and every day in Massachusetts, in Pennsylvania, in Ohio, and it is hurting small towns all across America. That is his greed, and I'm glad. Thank you for trying to hold him accountable.
Beautiful. Thank you.
Thank you.
Great job. Thank you. Thank you. Now we're going to hear from Dr. Ilana Stinson from the New England Medical Association, emergency room physician, formerly at the Kearney and Quincy hospitals. Thank you, Doctor.
First, I'd like to really thank the committee and Senator Markey for really bringing this to attention. This is not something that has happened overnight. It has been happening for years and over a decade. And I really want to thank my nursing colleagues for really being brave up there today, giving their stories, because it hit me to the core, not only because of the pain and anguish that these facilities are causing patients and communities, because of a lot of similar things that you mentioned, I also experienced as a physician in Boston. So my name is Elena Stinson. I'm a board-certified emergency medicine physician in Boston. I'd worked with Steward from 2013 to 2020. Stepping away when I noticed a lot of changes I was uncomfortable with. I worked primarily at Kearney Hospital, which shuttered their doors just a few weeks ago, devastating a community that is pretty much black and brown and underserved. I split my time at Quincy Hospital, spending my time 2 years there, at the last 2 years of Quincy hospitals before they shut their doors several years ago, making Quincy essentially a medical desert. I also work sporadically at Good Samaritan's Hospital in their emergency department. And my experiences with Steward was more than an eye-opener with how lethal and life-threatening the corporate practice of medicine was becoming, not only to patients I served, but to the overall well-being of our communities, in which I both worked and lived. Working at Quincy Hospital, I saw the devastation limitations in my practice of medicine with the loss of services such as anesthesia, surgery, and specialty services, a lot of those stories today, and it became a bare-bones standalone emergency department, which was not sustainable for the community of Quincy. We had less resources. We were limited to limited blood products or no blood products at times when patients needed blood transfusions. We had limited respiratory therapy services when patients needed ventilatory management. And oftentimes we had a broken CT scanner that barely worked. While at Kearney Hospital, we watched over time the dwindling of specialty services that ultimately required us to transfer patients unnecessarily, delaying their care to a surrounding facility. Things we once had were no longer available. My breaking point was when I realized changes were solely made for financial gain and no longer offering the care I was accustomed providing. I realized the care of the patients would be directly affected by these decisions, and these decisions would force me to compromise care delivery and would ultimately compromise access to care for the entire community. Now that we've seen that the devastation impacts on the Dorchester community in which Kearney once existed in Massachusetts, they no longer have access to timely care, and this will require those in the community to travel further to simply access emergency services. I personally would like to hear from Dr. De La Torre how he made these decisions to siphon off so many services. I really want to know how he's able as a physician, as a fellow physician, to be okay with causing so much harm to patients, to their families, and the communities, and also how he's able to cause so much harm to his fellow physicians as well. His decisions will forever leave a devastating impact on these communities, and I want answers to see how we in Massachusetts can begin to rebuild a stronger healthcare system in these communities to make sure the patients have access that they need. We need to make sure the healthcare teams are placed in the best positions possible to deliver care and absorb all the stress and strain from this fallout. Thank you.
Thank you, Doctor, so much. Yeah, Dr. Stinson took the Hippocratic Oath, first do no harm. Dr. DeLatorre took the Hippocratic Oath, first do no harm. Harm is the only thing that Dr. DeLatorre has visited upon the Steward Health Care system in Massachusetts and across the entire country, and we are going to make him accountable. Next, we're going to hear from Ellen McGinnis, a nurse at St. Elizabeth's Medical Center in Boston, Massachusetts. Welcome.
Thank you, Senator. Thank you to all of you who are here today. I have 4 words: degrade, defund, demonize, and destroy. These are the 4 steps that corporate entities, the greedy for-profit companies that took over our hospitals, our mission hospitals, our public hospitals, our hospitals that took care of the most marginalized among us, uninsured, underinsured, publicly insured, have lost, in many cases, they've lost access to this because of corporate greed. We need federal legislation. We need health over wealth legislation to pass. We need Ralph DeLatorre to be held accountable for what's happened and what hasn't happened, the lives that could have been saved, the trauma that could have been avoided. Had he left all that money, hundreds of millions of dollars, at the hospitals, at the physicians' offices, in the CT suites, in the labor and delivery suites, had he left that money where it should have been left to be used to keep patients safe, to take good care of patients, imagine, just imagine how good life would be for so many people if physicians could have practiced and delivered the care that should be delivered, the minimum standard of care in emergency departments, in surgeries and ICUs. What a great place this would be. It's not. That's not how things happened. And I'm so grateful to Senator Markey and Senator Sanders and all the rest of the committee and those of us who are here today. I'm so grateful that finally somebody's going to raise the flag and say, Uncle, we can't do this anymore. Reel in this corporate greed, pass some legislation that will prevent this from happening again, and get back to taking really good care of our patients and our communities. Thank you.
Thank you so much. Beautiful job. Next, we're going to hear from Audra Sprague. Audra works at the Neshoba Valley Medical Center, or she did work there, with 1 month's notice. Steward shut down Neshoba Hospital 2 weeks ago with 1 month's notice to the patients, to all the nurses, to all the physicians. So welcome, Audra.
Thank you, Senator Markey. Thank you for the opportunity to get this issue out and get it addressed. What Steward has done, we've heard it time and time again, it's been terrible, but there are so many people that have no idea that this has gone on and no idea what's happened because they've been lucky enough to not know the need of having an emergency department with a reasonable drivable distance for them if they do get gravely ill and where minutes matter. And if the Health Over Wealth Act isn't passed, then if it may not have happened in your state yet, it will happen that somebody will come in and take everything they can out of it because there's nothing right now to stop it from happening. So this act and these laws put into place will protect all of the people that don't even know that this is going on every day. The people that are walking by kind of looking like, what's this? You know, like they don't know that what's going on right now will protect them. in a month, in a year from now, if it gets passed, which it absolutely needs to. When Steward came in and closed our hospital, they had no regard for any of the employees, any of everything. Working for Steward is like working for an abusive boyfriend or husband, because they isolate you from everything. You have to use their physicians, their hospitals, their mail-away pharmacies. Everything has to be for them, if you get your benefits through them, which quite a few of us did, a majority of us did at that hospital, and that's, you work because you need health insurance and income. And now, all of a sudden, in 30 days, they're gone. They're going to be out and closed, and we have no health insurance, we have no doctors, we have no hospital to go to, and they get to set the costs of what the COBRA insurance is. And my option now, in 15 days from now, will be to get COBRA, which is $2,500 a month. For where I used to pay $200 a month, $300 a month for coverage. And my son, who I spoke about in the hearing, has type 1 diabetes, and the insulin is a little bit lower now, which is great for everything that's come in to help with that. But the technology, the pumps, the CGMs, all of those are important to maintain great care and great blood sugar monitoring, which affects your health overall. And without health insurance, you can't afford those, and they don't care. They did nothing to set up for anybody in the community, where to get care, how to pay for it, how to get there. They don't care. And they closed Neshoba, and our community has nothing. We are out in a rural area. They're like, oh, well, there's another hospital 14 and a half miles, 15 miles away. It's not 15 miles on a highway. It's 14 and a half miles on, back roads, windy roads. In the winter, we get a lot of snow up in New England, so it's not, we had Pepperell, which is a town a little bit away from us that we service all the time. They had to go on a Sunday evening at 10 o'clock to bring a patient to the next hospital, one of two that are like the realistic hospitals that people will go to. The Steward, of course, listed several others, but it's not realistic that the patients are going to go there quickly for emergency care. That ambulance, from when they left their station, got to the hospital, dropped the patient off, and got back into service, was 2 hours and 15 minutes. They were out of service. So that meant that town didn't have ambulance coverage for 2 hours and 15 minutes. They had to request station coverage from another town that's got one service. And so now, then somebody's got to cover their town. But if they're out on a call, it's not sustainable. There is literally a healthcare desert where we are now. There's just not enough. We were a small community hospital who provided a huge impact, and now it's gone, and something has to be done to stop it. If I could stand in front of Ralph De La Torre and say to him, was this your plan going in? Did you buy this back in 2011? I'm going to take everything I can from all these communities over and over, and nobody's going to stop me, and nobody's going to say anything. Or did it kind of slowly happen? And does he care at all? I can't imagine a person that can do all of this and just go about their day on their yacht and be okay with it, So I appreciate everything that everybody on this committee has done and the legislation that's being pushed forward. And if you can get out and vote for it, I urge you, because like I said, it will happen to you in your community. I guarantee you. And thank you very much.
Yep, thank you. Thank you. And, Audra is right. This hearing was important because it's a preview of coming healthcare atrocities in community after community across our country. This phenomenon of private equity coming in and treating this industry, hospitals, nurses, doctors, patients, as though it's a coffee chain or it's some manufacturing company. No, it's not. It's at the heart of the community. It's at the heart of providing care for everyone. So this is a hearing where we're providing the warning, but at the same time, we're now going to take action, and the Health Committee has now noticed a vote on a contempt citation of Dr. De La Torre for next week in the Health Committee. So we're just still at the beginning of this story, but we're going to ensure that there is accountability. We are going to make sure that actions are taken. So finally, we're going to hear from Eileen O'Grady from the Private Equity Stakeholder Project. Welcome.
Thanks so much for the opportunity to speak. Private Equity Stakeholder Project is a nonprofit watchdog organization that looks at the impacts of private equity and other kinds of financial actors on people and the planet. What we've heard today about Ralph De La Torre and Cerberus Capital's looting of Steward is horrifying. But as Senator Markey, as Randy Weingarten has alluded to, we have to recognize that this isn't a standalone case. It's just the worst case scenario of the private equity business model that is intensely focused on maximizing profit at all costs. And it's indifferent to the impacts that it has on healthcare workers, on patients, and on the communities they serve. At Private Equity Stakeholder Project, we found that 1 in 10, almost 1 in 10 private hospitals in the U.S. are owned by private equity firms like Cerberus. Many of those are safety net hospitals, which serve poor and uninsured patients. That includes what Senator Murphy referenced earlier in the hearing, Prospect Medical Holdings, which looted hundreds of millions of dollars and gave it to its private equity owner despite deplorable conditions at those hospitals. It's troubling. But I also want to recognize that hospitals are not the only place that PE firms like Cerberus have set their sights. We've seen private equity investing in virtually every aspect of the healthcare industry, owning mental health clinics, addiction treatment centers, operating group homes for people with disabilities, dominating the market for motorized wheelchair parts, for the diabetes supplies earlier referenced. We've seen that private equity ownership of nursing homes can increase the mortality rate of patients by 10%. We've seen that PE-owned staffing companies are some of the biggest culprits behind surprise medical billing. We've seen an explosion of private equity firms buying up dental practices, including one firm whose pressure on dentists to meet profit quotas led the Department of Justice to allege that the company was performing medically unnecessary root canals on babies. The financial tactics are a big part of the private equity playbook, including loading their companies up with debt that the PE firms are not on the hook for. Those can have really significant impacts on our broader health infrastructure. We found that last year over 20% of healthcare bankruptcies were by private equity-owned companies. And just in the first 6 months of this year, that trend has continued. Almost a quarter of healthcare bankruptcies that have happened this year were by private equity-owned companies. Like with Steward, those bankruptcies can have huge impacts on communities. It can mean layoffs, closures, cutting off critical healthcare services. But in most of these cases, the PE firms that own these companies have made their money and left workers and patients out to dry. The Steward crisis isn't the first time this has happened. And I really believe that Cerberus and Ralph De La Torre's profiting is just the tip of the iceberg. We have a lot of work to do to hold these people accountable. But if nothing else, let's make sure that what has happened here can never happen again. Thank you.
Thank you. Great job. Beautiful. Are there any questions? Any questions that anyone may have about anything? Yes, ma'am. Who are you?
Hi, my name's Hannah. I'm a reporter with Mother Jones.
Mother Jones.
I wanted to ask, do you have any plans to question any executives from Medicine Properties Trust, and if so, who specifically?
Yeah, we're at the beginning of this investigation. Obviously, Dr. De La Torre is the originator of the entire plot. So we want to begin with Dr. De La Torre, but we don't intend on ending there. But in order to understand the story from the very beginning until the closure of Nashoba just 2 weeks ago, we have to understand the plot as it unfolded, as Dr. De La Torre brought in Cerberus, brought in Medical Properties Trust, brought in a lot of other players. But there's one person who can tell the whole story. There's one person who can explain the whole thing. But we intend on getting to each and every one of those additional players as well. Yes, ma'am.
I'm Bo Tessick from the American Prospect, and I'm just wondering if you have any thoughts about why Ralph, obviously legislation needs to be passed to deter future Ralphs from doing this again, but he did a lot of things that were pretty egregious, including he's wanted in Malta. But why is he not in prison? Why hasn't the FBI raided Steward or Medical Properties Trust? What do you think is to account for this total lack of action
I'm afraid that too many people viewed private equity as just a player in the American economy, and whatever they do to any sector of the economy is just part of what has evolved as the American economic system. But this story of how it's impacting the healthcare system, it's different. And so to the extent to which we're putting a spotlight on this issue at our hearing up at the Boston State House, and now before the Senate Health Committee, it's meant to ensure that the spotlight is on it and it doesn't go off until there's full accountability and that we make the changes that are necessary. Just understand that the subpoena which we issued, the contempt citation, will be the first in 4 decades coming out of the committee. So this is historic, what we're doing. And we're not going to go away until we get the answers for all of the healthcare workers and patients across the country. And we're not going away until we put the safeguards in place, the guardrails in place that make sure that all of the remaining hospitals in the country are given the protections they need against the future Ralph dilatories coming into their hometowns. Any other questions that anyone may have? Yes, sir, who are you?
Stetson Miller with Gray Television. Can you just tell me a little more about how the Health Over Wealth bill would specifically stop another scenario like this from happening?
Yeah, it would require full transparency of everything that these corporate raiders do to the hospital system. It would require as well full accountability for all of the perpetrators of the actions within these institutions. It would require private equity to put together an escrow fund on the side that ensures that there's full funding that can be drawn upon when these hospitals are in trouble. So we have to set standards now for private equity if they're going to be in the healthcare sector, because we can't allow them to treat it as though it's any other sector of the American economy. So that will be the job that we now have to move forward on. All issues go through 3 phases: political education, political activation, political implementation. So today was political education. Next week, we're going to have political activation when we vote on contempt charges for Dr. Dilatory. And then we're going to move on, ultimately, after more hearings, more evidence gathering, to the political implementation phase, where we put the protections in place for the hospital system, for the healthcare system of our nation. Yes, ma'am.
Can you just clarify, did you say this is the first time the committee has pursued contempt charges and for the first time in 4 decades?
4 decades, yeah. My staff has the exact dates on that, but we can get them to you. Yeah, it's 4 decades. Yeah. Thank you all so much. Thanks for being here. Much appreciated. Wow.